Good morning. Today we'll be talking about IUI or IVF. What you need to know. This is a special edition in honor of the World IVF Day, which is coming up in a couple of days' time on the 25th of July. And we'll be digging deep with two very special people. Thank you, Dr. Amdii, for coming on the program to share your knowledge with us, and Mrs. Aketi. It is a pleasure to have you with us as one of the Aspire ambassadors to share with us your personal journey. So if I can, I'll start with you, Dr. Amdii.
Yes.
Can you tell us about, what is IUI and what is IVF?
Okay, thank you. Thank you for having me. IUI is an abbreviation for intrauterine insemination. It is a form of fertility treatment in which the sperm of the man is being washed, specially prepared, concentrated, and rid of debris before it is transferred uterus or into the womb of the woman. So in other words, it just shortens the distance that sperm normally has to travel in the reproductive tract of the female from the vagina through the cervix. In this way, it overcomes all the obstacles that sperm usually will have to encounter before reaching the egg. On the other hand, IVF, in vitro fertilization, also an abbreviation for a form of fertility treatment, represents the end of the spectrum for those who are looking for trying to conceive, because before you come in for fertility treatment, one must have tried non-orthodox ways in some occasions or sometimes. Sometimes they also try orthodox ways of trying to get pregnant. And then, of course, by the time they are coming to a specialist for IVF, it means that they are at the other end of the spectrum. So IVF simply means in vitro fertilization. And then I'm going to add the other end of the abbreviation, because you can fertilize. IVF simply means what the body does inside, which means in vivo. So in science, in vivo means something that occurs physiologically, while in vitro means something that happens outside the physiologic confines. So in IVF simply means fertilizing the egg of the woman with the sperm of the man, but this time around, instead of occurring inside the body, it is occurring outside the body at very specific predetermined conditions. And then, of course, the end of the treatment ends with embryo transfer. So you can see that while IUI addresses the issue of reducing the distance within which the sperm needs to travel from the vagina all the way through the cervix before it gets into the uterus, IVF simply talks about transferring an already fertilized egg into the womb of the woman. It's a little bit more intricate and more technical.
I think a little bit, it sounds a lot more technical, actually. You're talking about things at a microscopic level.
Yeah.
So as opposed to a gross level of just transferring a sperm into the vagina or into the uterus, you're talking of microscopically taking out the egg and taking out the sperm and joining them together and actually having the embryo, the result of fertilization, put back into the womb. So that's amazing. So it's actually a phenomenal treatment and a huge advance that science has brought to us. So if we can ask, what, who gets it? You've talked about it being the end of the road, or rather a huge, as you said, scientific discovery that is enabling people who are not able to get pregnant in any other way to have this treatment to actually successfully get a baby. But who needs it? So when we talk about first, who needs to come in for fertility treatment? You can advise when a couple needs to come in for fertility treatment. And then can you tell us who needs to get what and why?
Thank you. Fertility treatments with special emphasis to in vitro fertilization and any other additional fertility treatments, which we are discussing here, context is the IUI, slated for specific groups of clients or patients. And usually, as we always say, when a couple have been trying to conceive for 12 months of repeated and uninterrupted um, um, intercourse, and they are not able to get pregnant within a year, that's 12 months, then that's what we talk about infertility. All right. So those who need in vitro fertilization, embryo transfer, intrauterine insemination are those who fall in between the category of trying for more than 1 year of conception, and they have tried on some other orthodox methods of conception. For example, there are other orthodox methods of conception, including stimulating the ovaries for women who are not ovulating, for example, and then, giving drugs, and then the man and the woman meeting at a specific time, what's called ovulation, induction, and timely intercourse. So some people have already tried this within a year of maybe being together, and they are not getting pregnant. So those are individuals, those are candidates for in vitro fertilization. Now, also, usually, as we all know, fertility is age related. So most of before now, it was thought that age-related fertility decline is tied only to the woman. But now papers have been churned out that's now showing that even with increased age in the man, there's also decline in his fertility. So usually for couples that are between the age of, let's say, 25, 35, these are the line of couples that usually will try for a year. Once a couple is above 35, you can't wait for a year anymore, because fertility at 35 has declined by half. So in that case, for example, a woman is born with about 1,500 eggs in her ovaries. By the time she gets to 35, that number reduces to 400,000. So people who are in this age group and have been trying to conceive for 6 months may not even necessarily go the route of other orthodox methods of conceiving. They may need to come for in vitro fertilization. Women with blocked tubes. Now, the uterus, which is the womb, as it's being referred in general context, has an entrance, which is called the cervix. It has a cavity, which is called the endometrial cavity, and it has 2 tubes, one on the left, one on the right. For pregnancy to occur, the egg must travel through the tubes and meet with the sperm. So a woman who has either one of the tubes blocked and has been trying to conceive for 1 year does not necessarily need to wait for any other orthodox methods other than in vitro fertilization. Or, of course, in women who both tubes are blocked, automatically become candidates for in vitro fertilization. Men who have reduced sperm counts, those counts have been reduced either from previous testing or from previous history-related issues, injury to their genitals. These are people or other conditions that can actually lead to reduction in sperm count. These are all ideal candidates for in vitro fertilization.
So thank you, Dr. Amdii. Could you tell us, you've explained to us in detail what it entails, but I'd like you just to distinguish for those who are out there who have been told, you need IVF treatment. Simply, what is the difference between IUI and IVF so that they know which one is best for them and they don't spend their whole time and effort actually doing IUI when they should have actually just gone directly to IVF?
Okay, so IUI is an abbreviation for intrauterine insemination. In terms of those that will be needing IUI, the requirements are that the man's sperm, everything about the man's sperm is okay, right? The man has been checked and everything about his sperm checks is fine. That's on the man's side of things. So the man is okay, everything is normal from the man's end. For the woman, usually the women that will be ideal candidates for IUI should be between the ages of 25 and 35. Then her own testing too. They have usually done tests to check her egg stores or egg reserve, and everything is okay from her own end. And also, you know, from her own testing, from her own hand, there's no issue of hormonal imbalance. There's no anything there. So everything from the man and the woman are normal. Those are the people that usually would benefit from intrauterine insemination or IUI. Now, for the IVF, who are those that will benefit from the IVF? It's people who either have tried, for example, some people have tried IUI before, maybe once or twice, and it did not work. Understand? So those are candidates that will come for IVF. People who have been trying to get pregnant for, let's say, more than a year to 3 years, and they have not been able to get pregnant, or in situations where the man's sperm has been checked and it shows that there is some abnormality in the man's sperm. Those are the kind of people that will actually benefit more from IVF. So the longer one has been trying to get pregnant, the more the chances that IVF may be better suited for you. But if you have been trying to get pregnant for a short while and everything is okay from the area of the man's checks and everything is okay from the area of the woman's checks, then IUI may be suited for that particular couple.
Thank you. I think that has really made it so simple and really clear. Because there are people who, everything seems okay and they don't know, why aren't they getting pregnant? So they can come in and have the simpler procedure of the IUI. But if there's anything abnormal in a nutshell, anything that is really technically wrong there, then IVF is the way to go because that will make it, make it more successful. And people should just waste their time doing cycles and cycles of IUI, waste their funds, wasted. And I think most important is the time, but go straight into IVF. And I think that has really cleared it up for a lot of us. Thank you very much. Wow. Thank you, Mrs. Aketi, for coming to join us on the program. The theme of
Thank you.
this year's World IVF Day is celebrating miracles, honoring science, and embracing hope. And you actually embody all that. We want to celebrate your own miracles. We want you to honor the science that helped you to get there. And we want you to stand as hope for the hundreds of thousands of couples out there who are trusting God for a child. So if you can just share with us your story and your journey. How did you end up with those miracle twins that you have right now?
Um, it was really, I don't know how to start, but God did it. I waited on 6th of April 2002, waited 2003. I waited for good 5 years without anything. There was prayer, natural medicine, medical checkup, but nothing seems to work. Until a day that my sister-in-law, I went visiting. She was even the one that told me, share their data, why don't you try IVF? I was like, IVF? She said, yes, assisted conception. I said, okay. If we cannot do it naturally, why not go for what she said? I even thank God that the idea came from her anyway. And she specifically mentioned the beach clinic. So I went, the first day I went alone. Then later I went with my husband. In fact, when I go to the bridge clinic, the ambience alone, the reception, I said I'm going to add my children in this clinic because the staff were so lovely, smiling. I said, wow, are these people Nigerians at all? But to the glory of God, I was told that in case the first attempt might fail, I said, no, mine will not fail. But with prayer and I don't know, God did it. I was expecting to have one. I had two, to the glory of God, Peter and Paul. My boys are doing fine. They are normal children. They are very intelligent. They are handsome. And they are in the university now, to the glory of God, 200 levels. That's my
That's
story.
fantastic. That's
Yes.
fantastic. And what was there? Was there a male factor problem, or was there any or female factor problem? What was the problem that they
It
detected
was a male
that
factor. Yes, it was a male factor problem. My husband had low sperm count.
okay. And
Yes.
that was overcome by using the IVF method. And so your
Yes, it
two
was.
miracles, Peter and
Yes,
Paul, we thank God for
yes.
them. And today, in advance of the World IVF Day, we want to honor the science, the IVF, that has made it possible for you to stand here and, be that beacon of hope. So, can you give a few words to women who are out there? Because a lot of women are believing God for a child and they don't want to go in for IVF. I don't know if you want to give them some words of advice, some words of hope.
Yes, I will. A lot, if you have been hoping and praying and waiting, I can assure you that miracle still happen. And if you go to the bridge clinic, you will come back smiling, testifying. And if you're already on that path of IVF, I want to assure you that you are not alone on the journey. The staff, everybody in the bridge clinic, they are there. And the God that did mine is going to do yours. So do not lose hope. Miracles still happen. And God is surely there. God will answer your prayer. If you have been trying to conceive naturally and it's not working, just take the bold step and go for IVF.
Well, thank you so much, Mrs. Aketi. I think it's
Thank you.
always inspirational to hear not just the fact that you went through the process, and but the fact that your children are doing well, they are normal children. These are all the things that a lot of people worry about. So thank you for sharing that with us, and thank you for giving hope to the many out there who are wondering what to do and what steps to take. Dr. Amdi, if I can come back to you, and talk about, we're celebrating the miracles of Peter and Paul here, and we want to talk about honoring science. So, can you tell us some special things about IVF, and if there's any new innovations that are available that have moved things forward that make it even better now?
Okay. Thank you. IVF, we are approaching in a few days' time, the World IVF Day, and it's a day where we will celebrate the miracles that IVF has brought in, honor the science, and then of course embracing hope, for giving more people. Now IVF has come a long way, and here at the Bridge Clinic, the innovations that have helped to improve, how we go about things, and that leads to our rates of success, which we actually discuss very, very proudly and evidently, because we can see the products. For IVF, before now, IVF used to be, just, like I explained in the previous section, dropping the sperm and the egg of the woman in a dish and allowing nature to take its course. But now, with the advances in science, there is a newer method to even further improve success rates, especially in people who have, for example, like the client that just shared with us now, male factor problems where the sperm is the issue. So even if sperm is so reduced, there's a newer technology which is called ICSI, intracytoplasmic sperm injection. What it means is that in the normal IVF, like I said, you leave the sperm and the egg in a dish and allow nature to take its course. Now with science, we can actually carry the sperm and push it directly into the egg, under a microscope, and then to be able to lead to pregnancy. So yes, and this has actually improved success rates for IVF, and has also given those, especially men with male factor problems, the opportunity to become fathers.
What about men who have no sperm, azoospermia, that have no sperm at all? Is there anything special that can be done for them?
Thank you. Of course. Thank you for that question. Azoospermia, there is a condition in which men don't have sperm. So in that situation, science has also gone further, and Bridge Clinic happens to be the pioneer of use of tissues from the scrotal sac of men who cannot produce sperm, a procedure known as surgical sperm extraction. So men who don't have sperm in their ejaculate or when they reproduce, when they meet with their partners, we can actually surgically go into the testis of the man and retrieve tissue. And it has been documented that we have been able to isolate sperm cells from active motile sperm cells from the testis of such men, and enabling them the opportunity to become biological fathers to their children.
Well, that's amazing. And I think, for me, having all this science really brings hope, because people now know that they don't have to suffer in silence anymore, that there are advanced centers that can provide this. And I know that coming up this weekend, also in honor of the World Health Day, I think you're having a welcome forum. I don't know if you want to invite some of our listeners to what you'll be doing on Saturday.
Thank you. In commemoration of the World IVF Day, on the 26th of July, 2025, Bridge Clinic is organizing a welcome forum, a special edition of a welcome forum to key into the theme for the World IVF Day, which is celebrating miracles, honoring the science of IVF, and embracing hope. We're going to have special packages which will be unveiled on the day the program on Saturday. We will start at 10 a.m. prompt. You are more than welcome to invite your friends, your family, and all your relatives, especially those of childbearing age, to our various branches. We have a branch in Abuja at Umaru Diko Street in Jabi Crescent. We have a head office in Lagos at 66 Oduduwa Way in Ikeja. And we have the Port Harcourt branch, where we're expecting you to come and enjoy some of the packages that you will be seeing on that day, apart from also knowledge which should be shared. We're looking forward to seeing you with your family and your friends.
Thank you very much. Thank you for watching. Please like, share, and subscribe for new video updates.